Specialty Story, session number 91. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. My name is Dr. Ryan Gray, your host here every week, where I get the amazing opportunity to talk to a physician about his or her specialty. This week is no different. I get to talk to an amazing community-based dermatologist who's been out in practice now for 5 years. And she's going to talk about how she first became interested in dermatology, what led her down that path, and what her interests were that led her to become a dermatologist. We talk about all that and so much more. So let's go ahead and jump in and say hello to Dr. Reid and find out when she first became interested in dermatology.
So it would probably be in medical school. I did many rotations, as one is expected to do. I did pediatrics, which I liked. I did general surgery, which I enjoyed. I did internal medicine and immunology, rheumatology. I did some path even and infectious disease, and the problem was I liked them all.
Yeah.
I realized I liked everything, and honestly, I couldn't decide. So one of my peers at the time, who's now my husband, suggested dermatology because it would give me the opportunity to have a piece of all those different specialties rolled into one. And from that moment, I did a dermatology rotation, and I was hooked, and I knew it was the one.
What do you think it was about every specialty, every nuance of everything that you were doing that interested you in everything?
I think really, I liked being able to switch from surgery to seeing a kid or pediatrics to seeing an older patient, geriatrics another day, and that's exactly what dermatology is. Um, it's really a lot of different specialties: internal medicine, pediatrics, pathology, even technology based with laser dermatology, infectious disease based. So it's really a versatile specialty. It's one of those fields of medicine that you can really tailor what you want to do, how you want to spend your time, what patient population you want to see, and tailor your practice to your population. So I also, did a rotation in medical school in Malawi, Africa,
Mm.
and I studied tropical and infectious disease dermatology, which was so fascinating and just all encompassing. And that was the tip of the iceberg for me. It really showed the versatility of the field. And I knew there was nothing better after that.
It's interesting. I've
Yeah.
talked to emergency medicine physicians on this podcast,
Hmm.
and they have very similar answers as to why they chose emergency medicine. Is they really
Yeah, you're
liked
right. Yep.
everything, and emergency
Hmm.
medicine gave them that, and so you found another specialty that kind of
Right.
allowed you that as well. And they kind of consider themselves a variety junkies, and it sounds like you're very similar.
Exactly. Yep.
Great.
Um, I guess also, for me, to be honest, you really can do everything in dermatology and not feel overwhelmed. I'm able to be present for my family and my kids and control my schedule for the most part with limited calls and a few patient emergencies. So I guess that would be the difference between dermatology and emergency medicine to some extent.
Yeah.
Um, you know, and then if you wanted to be an academic dermatologist who works in a university hospital, of course, there's a higher likelihood of emergent cases and call opportunities if you so choose.
Yeah.
So I just think you just have a little bit more of an option with dermatology.
What traits do you think lead to someone being a good dermatologist?
Um, so that's a good one. So for one, dermatology tends to have a very high procedural component. So definitely having good manual dexterity and surgical skills is important. Um, Being a visual person or the ability to follow visual cues and pattern recognition is important to a lot of dermatology diagnoses. Um, and of course, having that attention to detail and being able to have good relationships with patients. You have to be an active listener and an active learner. So, that commitment to your patients and being able to listen. Patients rarely come into a dermatology office with a straight story or a sequence of events describing a skin problem. Usually they're referred by other specialties. So, family medicine, internal medicine, rheumatology, pediatrics, an allergist, and they all come with ideas about what the diagnosis should be, and usually treatments that they have already tried. So it's really important to be able to take a step back and start from zero every time a patient enters your office. So I think building relationships with patients is important, and being able to listen is a big part of dermatology as well, because there's a lot of face-to-face patient interaction. So if you don't love people and you don't love patients, then dermatology is probably not the field for you.
Medicine is probably not the field for you.
Exactly.
That's funny. Now, you mentioned
Yep.
academics and kind of a different work-life balance, et cetera,
hmm
with potentially academics versus the community where you're at. For you, what was that decision
hmm
algorithm like? Why not academics? Why community for you?
For me, it was pretty easy. I actually work in a single specialty private practice, but I also work about 30 minutes from a major city academic hospital. So for me, I actually kind of dip into both worlds. I work in private practice 4 days a week. I see patients in a clinic, and I'm also on call in a hospital, an academic hospital, a couple times a month, which I do get to see those, acute cases, um, you know, drug rashes, patients that come in with acute changes in their skin conditions, for example. And so for me, it was pretty easy because I got to do both. Um, but I do like the stability of private practice, being able to set up my time and my days. For the most part, I see um, a variety of patients, old to young. I do skin cancer checks. I see chronic skin conditions. And then the next day, I do surgeries or procedures. And the next day after that, I'm back in the clinic seeing patients. So it's just a lot of variety. And for me, that was an easy choice.
For an outpatient community-based dermatologist, what's kind of the bread and butter stuff that you're seeing day in and day out?
Okay, so for me, um, I know a lot of people have the assumption that dermatologists is, all they see is acne and eczema.
Hmm.
We do see that, but for me, acne is actually only about 10% of my practice, maybe even less. So the majority of my practice, I do majority medical or general dermatology. The majority is skin cancer based. So a lot of skin cancer checks on patients older than 40, and I also see a lot of chronic skin conditions like psoriasis and eczema, and some other autoimmune conditions like alopecia. So I see quite a variety, but mostly I would say the majority of my clinic base is skin cancer related.
Okay.
I also do 1 day a week or a half a day a week of cosmetic dermatology. So if that's something that you're interested in, there's also an option to do that.
And what does that mean?
Um,
What does that look like?
So basically, minority, of procedures, basic cosmetic procedures, Botox, fillers, and some very simple injectable procedures.
Okay.
hmm
For the patients that are the non-cosmetic patients, what percentage of them are coming to you with a diagnosis and you're there for definitive treatment versus they're coming to you with some weird lesion or rash or something and you have to figure out what it is?
Hmm. It's hard to say. Let's see. So a lot of my patients that are coming to me, the new patients, I would say maybe about 20% of them come to me with a exact diagnosis. Um, a lot of the times, like I said, they're referred by other specialties, but when they end up in a dermatology office, it's usually because there's a problem with the diagnosis or there's a problem with the treatment that's not going well, or maybe they need some other ideas. So, a lot of the times we end up having to do a biopsy of the skin or the lesion or the rash, what have you, to determine where we are, send it off to pathology, figure out what that is, and then we go from there in terms of guiding the referring physicians as far as treatment and follow up care,
Yeah.
etc.
Now, you mentioned going from clinic one day to doing procedures the next day. What percentage do you think of the patients that you're seeing do you actually do procedures on?
So there's a wide variety of procedures in dermatology. When I say procedures, so in terms of a skin check clinic day, for example, out of 30 patients, probably I would say about 30% of them will have a biopsy done of a lesion or a rash to determine what's going on. So in terms of small procedures like biopsies, those are um, a part of kind of a normal clinic day.
Mm.
As far as excision of skin cancers, those are procedures that we schedule separately. And those are based on biopsies that come back as skin cancers that we can excise in the office. And those are patients that we see on a separate day, bring them back. And it's probably a 30-minute procedure for each patient that we can do outpatient, removing a skin cancer, a basal cell, a squamous cell, or small melanomas.
What's the line for your patients of I can handle this versus I need to send them to somebody else to do something more drastic?
So that's a good question. So when it comes to patients who have skin cancers near the eyes, for example, we send them to oculoplastics. For patients with skin cancers on the face, we have a Mohs surgeon in office. So that's one of the specialty. Mohs surgery is one of the special subspecialties of dermatology. So we are able to do, a lot of skin cancer excisions in my office because we do have a Mohs surgeon present. Um, when we have melanoma patients, for example, that have nodal involvement or are past stage one, we send them to surgical oncology. So we actually work quite closely with a surgical oncology at a major academic facility or a cancer center. And a lot of our large melanoma cases do go there for, sentinel node biopsies or excisions of larger melanomas, and then they come back to us for follow up and skin checks. So we work quite closely with that group.
You mentioned call and
Mhm.
what that looks like for somebody in the situation you're in. A little different because you are doing some stuff at a larger academic center. What does
Mhm.
call look like, at least for the community aspect, the outpatient stuff?
So call is very it's pretty much as you want it to be, honestly. So for me, it was a matter of just staying abreast and keeping up with acute current dermatology. It also keeps things exciting. Of course, there's not a lot of dermatology emergencies, but there are several that we do see. So, we split the call, based on our group of 5 providers, and we kind of rotate. So you probably get called twice a year, and you take a block of a month, and you're on call for that month, for example. I mean, but there are lots of other ways to structure call when you're a dermatologist. It's just something that you decide on with your group that you're working for, and it's something you can decide that you don't want to do. But it's always good to get your um, feet into acute dermatology, because that's a really important part of dermatology and keeping up with dermatology.
Mm.
Yeah.
Describe a typical day. I think a lot of students, when they hear how many patients dermatologists see, they may
hmm
freak out a little bit. Describe a typical day, how many patients you're seeing, and what's going on those days.
So again, that varies by dermatologist. I would say on average, maybe 30 a day is pretty average.
Okay.
It's a very fast-paced specialty, which is actually one of the things I wish I had known before I signed on to do dermatology. So I have about 30 patients a day. Most days a week, I would see patients, older than 40, like I said, for skin checks or chronic conditions, are also a big part of those visits. I also have adolescent patients with acne or eczema. I see infants and young kids with chronic and acute skin conditions. Um, and at the end of the day, if I'm working at the community hospital or I'm on call at the community hospital, I have to run after work to see an inpatient with an acute skin condition, for example. So during that day, in the clinic, a lot of dermatology is basically diagnostic and procedural. So I would be doing biopsies on skin lesions. I could be scraping the skin or skin rash to look under the microscope for fungus. There's also a lot of psychology involved in dermatology. People carry a lot of emotions when dealing with chronic skin conditions. Even if they're not life threatening, they can really take a toll on someone's quality of life.
Yeah.
So, a lot of compassion is necessary in dermatology. And then on other days, like the surgery or procedural days, I do, like I said, skin cancer excisions or destructive procedures where I destroy skin cancers by non excision means. Um, I also, I do very simple cosmetic procedures, like I said, Botox and fillers. I also do some teledermatology, so I'm quite busy, where I review pictures of cases of patients who are in rural settings. And patients basically are unable to come into the office, so I read images and can prescribe that way as well.
Hmm.
And I also do some volunteering through teledermatology platform where I assist in diagnosis and treatment of skin conditions in a clinic in Africa. So dermatology really allows you to have a further reach
Hmm.
because it's such a visual specialty. And then, of course, at the end of the day, you have an administrative component. So you have patient charts and you have patient notes for all those 30 plus patients that you've seen throughout the day. You have calling patients back with biopsy results. You will be doing lots of prior authorizations for medications and a lot of, treatment follow up. And so there is a big administrative component as well because you're seeing such a large patient load per day.
With all of the tentacles
Hmm.
of your job, do you feel like you have enough? I hate the word work life balance, but
I
enough
know.
enough time outside of clinical care for your family and everything else that you want to do as a human being.
Yeah, definitely. So, like I said, I feel like in dermatology, it's just one of those fields that you can choose to have little time or more time. For me, that balance is pretty set at 4 days a week, where I'm in clinic from 8:30 to 4:30. And, when I leave the clinic, I finish my notes, I leave clinic, I get home, and I do have time for my family and my kids. And it really does allow you a really good work-life balance, especially because, like I said, you can choose to do more or less.
What's the training path look like to get to become a dermatologist?
Okay, so dermatology residency is 4 years long. It is 1 year. The first year is basically an internal medicine year or a surgery year for people who are more surgically inclined. Or some people choose a transitional year or to do pediatrics for that year if they were interested in another subspecialty of derm, which is pediatric dermatology. And then dermatology itself, the 3 year component is done at dermatology specific residency, and that is where you just learn all the dermatology as soon as you step through the doors of residency. Basically, you start clinic day one, and you see a lot of cases. It's very clinic based learning.
Mm.
And you also see a lot of, you get exposed to basic dermatology in the first year mostly, and then you compound it with clinic time, consultation time in hospital setting. You learn Mohs surgery, dermatopathology, pediatric dermatology, and cosmetic dermatology. So it's 3 years of just dermatology. Um, And then you feel, like you're ready to start seeing patients on your own. You're pretty well prepared after the 4 years of residency to see patients.
You mentioned the internship year.
Hmm.
Are there programs that are that have that internship year built in and a
There
categorical
are
internship, or do you
actually.
have to
Hmm.
apply separately for everything?
So so you do have to apply separately, but there are more and more programs now that have a joint internal medicine year attached to their dermatology residency program.
Hmm,
Um, for example, Brown Dermatology has one. That's where I graduated, so I know
okay.
about that one. But I know that there are many others that are doing the same thing. But I do believe that you still have to apply separately. But there are options to kind of join both that are becoming more common.
Okay. Yeah, that's
Yeah.
interesting. It's one of those that
Hmm.
a lot of students that aren't aware. It's like those two, you have to apply to two different specialties and
Right.
match at
Right.
both,
Yeah.
and it's a lot of juggling to do.
It is a lot of juggling, from what
Yeah,
I remember.
yeah.
It's yeah, but it works out in the end.
What what does um the fellowship landscape look like? You said that it's that physicians who think they're ready to go on and start seeing patients, they can do that, or they can
Hmm.
go on and do a fellowship. What are those opportunities for fellowships?
So for fellowships, if someone wanted to do more surgery-based dermatology, they could pursue a Mohs or procedural surgery fellowship, and that is 1 to 2 years depending on where you go. There's also cosmetic procedural dermatology fellowships. Those are a few and far between. Most dermatologists are general dermatologists. I would say the next group is Mohs surgery. The other popular group is pediatric dermatology. So that's also a subspecialty of dermatology that someone can pursue if they were really interested in just treating the pediatric population. And also dermatopathology. So we have a lot of pathology in the field of dermatology. And dermatopathologists really either come from dermatology residency or pathology residency.
Hmm.
And so that's one of the subspecialties that's very competitive, but it's a really good career for someone who's interested in pathology. There are also laser dermatology fellowships, believe it or not. Those are very few as well. But I have a colleague who did a laser dermatology fellowship. And there's also becoming more common are these med derm combinations, and also derm room combinations. Even there's also even a medical dermatology residency now, I think, that's becoming more popular for people who really just enjoy general medicine, but they do want to specialize in dermatology as well. So there's a joint 5 year med derm residency as well.
Lots of options. And
Lots of options, yeah.
what was it for you that you're like, okay, I'm done. I want to go out. I want to practice and stay a general dermatologist?
For me, honestly, like I said, I really just love the versatility. I don't want to just do surgery. I really loved it, but I don't want to just do surgery every day and be a Mohs surgeon. I
Mm.
want that interaction with my patients. I want that relationship with my patients, and I want that variety. And so for me, the same reason I chose the field of dermatology was the same reason I chose to stay into medical or general dermatology.
We all know that, I think we all know that dermatology is a very hard residency to match into. What should
Hmm.
the medical student be doing to match into dermatology or to at least increase their chances?
So, getting a great board score is not enough.
Yeah.
um, we all have great board scores. So, if finding a mentor in dermatology, likely in your home medical school, is very important so that you have that support from your department when time comes for you to apply to residency. So, getting to know your dermatology department is important, but you also need to diversify your application. So, for example, some candidates have second degrees. For me, my MBA in healthcare management made me stand out. So, something that makes you stand out. I know a lot of dermatologists who have PhDs, who have MPHs, who have done some kind of research year. So participating in research is also key. And also doing lots of away rotations at other medical school departments so that you get to know that department, and that almost guarantees you an interview if you perform well at those away rotations. So that's also an important thing to consider when you're applying.
For the osteopathic students listening to this, what
hmm
can they do to overcome some of the negative biases out there towards them?
I honestly not that I'm aware of any. I work closely with DOs being in Pennsylvania.
Okay.
And I work closely with DOs at my current practice. And their training and ability have never been questioned by patients or staff. So honestly, I've never really noticed a difference or seen any negative bias towards the DOs that I work with. So
Good.
that would be tough for me to answer.
Good. No, that's a great
Yeah.
answer.
Yeah.
Okay. For the future primary care doc listening to this, family practitioner, internal medicine, what have you, what do you wish they knew about what you're doing day in and day out as a general dermatologist to help serve their patients better and to help you when they refer patients to you?
That's a great question. So I want them to know that dermatology encompasses a lot more than dealing with acne. Actually, like I said, acne is probably 5 or 10% of my patient load. Of course, this may be different for another provider. I'm just speaking for myself here. But most dermatologists probably see far more skin cancer patients than they do acne patients. And I want them to know also that dermatology has a lot of chronic illnesses that fall into many different, internal medicine umbrellas. So rheumatology, allergy, autoimmune category, and these take time to manage. It's not just a field where we just diagnose and that's it. I mean, a lot of dermatology problems are chronic, and they take time to manage, get the right medications, get the right balance, whether it be biologics or topicals or steroid doses, what have you. But that's what makes the field so rewarding. So it's not just a one-stop shop where you send someone for a biopsy and then it's done. We have to treat afterwards. So that's just one of the things I wanted to convey.
You mentioned a couple other specialties that you work closely
hmm
with. What other ones off the top of your head can you think of that you work closely with?
Okay, so um, of course, internal medicine, family medicine, but aside from that, believe it or not, we get some referrals from their emergency room. So we do talk to emergency medicine doctors quite a lot. Rheumatologists and dermatologists share a number of patients because of the overlap between autoimmune dermatology and rheumatology. And also, we work quite closely with pediatrics. Obviously, we get a lot of pediatric cases
Mm.
for some things that are even rare that exist in the pediatric population. And we also work closely with allergists when it comes to things such as contact dermatitis or people with really bad eczema or allergy flares. So that's also a specialty that we work closely with. And of course, surgical oncology is our friend.
Mhm.
So we work closely with surgical oncology and plastic surgery as well when it comes to repairing, skin cancers around the eyes or around the face that's beyond the scope of a Mohs surgeon.
Are there any special opportunities for dermatologists outside of clinical medicine for somebody who may grow tired of clinical medicine?
I don't see how you can grow tired of clinical medicine, but
I don't see either, but
yeah, I think like I said, teledermatology. I guess you can consider that still clinical medicine, but it takes you a step further away from that day-to-day patient care. So it's a field that I see expanding, not just in dermatology actually, but in all of medicine. But I think for dermatology it's easier because dermatology is such a visual field.
yeah.
So for one, that's an option. A lot of people do clinical research. A lot of people can do academia or going to teaching. um, I have a few colleagues that actually, kind of experienced burnout from just a heavy patient load and went into pharma, basically doing consultations or being consultants to pharmaceutical companies,
The dark side.
or being right, if you want to call it that, or being medical directors. I also have colleagues who've done a lot of clinical trial dermatology and kind of expanded their clinical base, doing that instead. So there are a lot of options out there.
What do you know now that you wish you knew before going into dermatology?
Well, for one, I didn't know that the administrative component would be so heavy, but I think that's going across all specialties
Yeah.
now with the changing face of healthcare. Um, but because we see so many patients, the administrative component in dealing with insurance companies to get coverage for simple dermatology medications, to treat skin disease is a daily struggle, for example. And it can sometimes impact your prescribing behaviors. And that's a shame because you want the best for your patients, but sometimes you can't get that because you have to fight with the insurance companies,
Hmm.
and they still won't budge. Um, but also, in addition to having to keep up with patient charts and documentation, fighting the insurance companies, is a problem. But I think now, they're just they're coming up with newer and more efficient documentation programs for every field, and medical records or programs are getting better. So hopefully that will ease the burden of the administrative component of dermatology and other fields.
Hmm.
Aside from that, it's a very hands-on and um, fast-paced environment. So if you're not able to cope with that fast-paced, hands-on environment, then dermatology is probably not the specialty for you. Um, I know that some of my colleagues are, they might work for a big corporation where numbers are important, so they're expected to see more and more patients. But like I said, this is a trend in medicine in general. Um, but like in any field, you have to decide what type of practice you want to run, and you have to decide what kind of dermatologist you want to be.
What do you like the most about being a dermatologist?
Um, I like my relationships with patients. I like that my patients are happy. For the most part, dermatology patients are happy because you're treating them and you're making them feel good about themselves. Um, and a lot of it is preventive. I, for one, in medical school, was not good at dealing with death or dying. And in dermatology, that's, few and far between where I have to give that diagnosis to someone. Usually we catch, a melanoma or a skin cancer in the early stages. Yes, you will, see that patient who you have to break the bad news to because their melanoma is far more progressed or more aggressive. Oh, they have a very aggressive type of lesion or another aggressive type of skin cancer. But for the most part, we share this burden with surgical oncologists, and it's definitely the minority of cases. I'm not going to say you're not going to deal with death or dying patients ever, but it's definitely less than some other fields.
Mhm.
So for me, the fact that dermatology patients are generally healthy and happy was what one of the things I really loved.
Yeah. What do you
Yeah.
like? What do you like the least?
um, Probably paperwork.
Yeah. Welcome to
Yeah,
every specialty out there. Yeah,
exactly.
they all say the same.
There's honestly not much I don't like about my field. If I were to go through this whole process again and choose, I would still choose dermatology, hands down.
That was one of my next
Hmm.
questions. That's good.
Oh, okay.
Do you see any major changes coming to the field of dermatology, whether it's new procedure techniques, new just innovation, new medications that are going to change the way future dermatologists are going to practice?
um, I think honestly, technology is playing a huge role in shaping the future of dermatology. Um, there are actually several non-invasive skin lesion tools that are on the market right now, with this special imaging used to identify a bad mole, for example, and it will probably guide decision making on whether or not a lesion should be biopsied in the future, or will help providers or practitioners make that decision either way. Um, they're not yet standard practice, but as time goes on, I can see these non-invasive imaging tools being more standard in dermatology. Like robotics, whole body mapping for detection of skin cancers will also play a huge role. So I think technology will definitely impact the field of dermatology in the future.
Yeah. A new
Yeah.
question I want to throw at you is, what do you think is the biggest myth that dermatologists have to fight every day?
um, I don't want to say that it's not a okay. So I think a lot of people think that we're, maybe a bunch of pimple poppers, like I said.
Thanks, Sandra.
I Yeah, nothing against Sandra, but I think a lot of people see dermatologists, the biggest myth is that most dermatologists are cosmetic dermatologists, and I think that's not true.
Mhm.
The majority of dermatologists are indeed general or medical dermatologists, who treat a lot of skin cancers and acute and chronic dermatologic disease. Um, so I think a lot of people don't, you know, they joke around. I have colleagues that joke around, colleagues that are cardiologists and general surgeons, and they joke around that dermatology is not as serious a field, for
Mhm.
example. And that's another myth. I would like to think that we do save lives every day when we catch a mole and stop it from changing, or remove a skin cancer. And skin cancers are becoming quite common even in younger age groups now. So I think dermatology is a field that has a long way to go still, and it's definitely going to be something that is impacting patients in the future, especially with increasing skin cancer rates.
Any last words of wisdom for the medical student out there who is now interested or more interested in becoming a dermatologist?
Sure. So I feel like I was one of the lucky ones, but dermatology is becoming more competitive. There are a lot of people who don't get into residency the first time they apply, and they do a year of medicine or a year of surgery or research, and then they apply again. And some people get in, and some people don't. I know someone that applied 3 times, and the third time was a charm. You know,
Nice.
so if dermatology is something you really want to do, like if you're really sure that that's what you want to do, and you can't see yourself doing anything else, don't give up if it's something you really want.
All right, there you have it. Again, that was Dr. Nyanda Reid, dermatologist, community-based dermatologist who's been out in practice now for a half a decade. I hope this was helpful for you, gaining some insight into the world of dermatology and potentially how you may be interested in dermatology if you are also interested in all of those different specialties that Dr. Reid was talking about. We have more great guests coming up in these next few weeks. I hope you subscribe to this podcast and let your friends know, let your classmates know that we are here for them to listen to every week for free on their iOS, Android device, or anywhere else where they may listen to podcasts. Have a great week. We'll see you next time here on Specialty Stories.